Welcome to the We Level Up Treatment Center video series. In today's video we will discuss muscle relaxers names, Cyclobenzaprine, Soma, Baclofen, their side effects, types and risks. What are muscle relaxers? Muscle relaxers are medications that are used to relieve muscle spasms, stiffness, or tightness. Popular muscle relaxer names and brands. Prescribed muscle relaxers names include Flexeril, Cyclobenzaprine, Scalaxin, Metaxalone, Robaxin, Methocarbamol, Soma, Carisoprodol, and Zanaflex, Tizanidine. Among these, the most commonly prescribed muscle relaxer medications are Baclofen, Carisoprodol, and Cyclobenzaprine. It's important to talk to your doctor before taking any of them as each has different potential side effects and interactions. Muscle relaxant uses. When blood alcohol level pain and muscle spasms produce significant muscle pain and suffering, doctors may prescribe muscle relaxants or muscle relaxers. Muscle spasms are uncontrollable contractions of one or more of your muscles that cause cramping or twitching. It can happen for a number of causes and occasionally be excruciatingly painful. The constitution, chemical makeup, and cerebral actions of prescription medications used as muscle relaxants can vary. Muscle relaxants typically have sedative effects or stop the nerves from transmitting pain signals to the brain by acting as central nervous system (CNS) depressants. The effects normally last between 4-6 hours, with a rapid beginning of action. Muscle relaxants carry the same abuse and addiction risks as other prescription medications. Centrally acting muscle relaxants have been identified by the National Center for Biotechnology Information as a potential misuse medication. Muscle relaxants addiction can be effectively treated using a variety of methods. Encourage your friend or loved one to discuss using alcohol treatment programs, drug abuse treatment, relapse prevention, or support groups as part of their recovery with their doctor or a treatment counselor. Over-the-counter muscle relaxer names. Over-the-counter muscle relaxers include ibuprofen, aspirin, acetaminophen, naproxen, and topical creams like Icy Hot. Additionally, magnesium supplements can also be taken to promote muscle relaxation. Currently, there are no recommended over-the-counter muscle relaxers available in the US. But some OTC medications can have muscle relaxing effects. Many people are searching for muscle relaxers over-the-counter or OTC muscle relaxers, but the common muscle relaxers are ideally prescribed for acute rather than chronic pain. Anyone experiencing pain and muscle spasms should see a doctor, who may recommend or prescribe a muscle relaxant. The potential consequences of muscle relaxants must be understood. There are numerous brands of prescription muscle relaxants available. Proper use of over-the-counter muscle relaxers. While over-the-counter muscle relaxers exist, they may not be appropriate for all types of muscle conditions. Any muscle relaxant should be discussed with a physician or pharmacist before consumption. Although skeletal muscle relaxants are occasionally the primary muscle relaxer abused, they are commonly used combined with other central nervous system depressants, such as opioids or alcohol. The primary toxic effects include unconsciousness and respiratory depression. It's important to understand what prescription drugs like muscle relaxers are and how they work in order to recognize their signs of addiction. Even though other drugs like heroin and meth receive most attention when it comes to drug abuse and addiction, muscle relaxers have the potential to become a user's preferred substance, if not their only drug of choice. Some people have been known to utilize alcohol as a muscle relaxant. However, doctors advise against this due to the possibility of psychological and physical dependence on alcohol's effects. Additionally, alcohol can be quite hazardous in higher doses even though it may have nice, calming effects in smaller doses. Alcohol with a wide variety of drugs can interact badly. Even moderate alcohol consumption, according to University of Oklahoma experts, can impair your body's capacity to metabolize pharmaceuticals or increase the effects of some prescriptions. Medication interactions frequently lead to extreme sleepiness and liver issues. Antibiotics, antidepressants, painkillers, antihistamines, barbiturates, opioids, and muscle relaxants are examples of drug classes that interact with alcohol. What do muscle relaxers do? Muscles come in two varieties: smooth and striated muscles. Muscle contraction is caused by chemicals inside muscle fibers. An involuntary muscular contraction known as a muscle spasm can be extremely painful and uncomfortable. Muscle contractions occur when it is deficient in a number of nutrients. Numerous factors, including exhaustion, overuse, diabetes, exposure to extreme heat, kidney illness, and more, can lead to nutrient deficiencies in the muscles. Muscle relaxants act by reducing muscle tension or stiffness, which lessens discomfort and agony. While some muscle relaxants work directly on the muscles, others focus on the central nervous system. Muscle relaxants pills shouldn't be shared, abused, or used improperly like any other prescription drug. Can you overdose on muscle relaxers pills? It is possible to overdose on prescribed muscle relaxers pills, including some OTC muscle relaxers. For example, taking more than the recommended amount of ibuprofen or acetaminophen can lead to overdose symptoms. It is important to follow the instructions on the label or follow the advice of a medical professional to avoid any overdoses or adverse reactions. Overdosing on muscle relaxants or taking them more frequently than recommended can be extremely risky and can result in addiction. Antihistamines and alcohol should never be taken with muscle relaxants. Despite the seriousness of muscle relaxer side effects, someone who has grown reliant on the medicine may find it challenging to stop using it. Are muscle relaxers addictive? Are you wondering, are muscle relaxers addictive? Yes, some people can become addicted to muscle relaxants. You run a higher risk of developing an addiction if you take them without a prescription or in higher doses than your doctor has advised. Since they have not been proven to be effective for muscle spasms for longer than 3 weeks, recommendations typically limit the usage of these medications to that time frame. They may have harmful side effects, such as overdosing, addiction, dependence, falls, fractures, and car accidents. Even though they are typically thought of as being less addictive than other classes of medicines, such as opioids, some muscle relaxants have the potential to be abused and can lead to dependence. Despite the fact that most people do not consider muscle relaxants to be very addictive, prolonged usage of these drugs might result in physical dependence. In other words, if a person abruptly stops taking the medicine, they can have withdrawal symptoms like tremors, anxiety, and insomnia. It's critical to follow a doctor's instructions when using muscle relaxants and to be mindful of the risk of abuse and dependence. It's a good idea to talk to your healthcare professional about your worries if you use muscle relaxants and worry about addiction. They can assist you in choosing the most appropriate course of action for your needs. Warning: muscle relaxer abuse can be deadly. Abuse and addiction are possible with muscle relaxants. Additionally, prolonged and frequent usage might result in a higher tolerance and physical reliance. Because of this, doctors should only prescribe muscle relaxants for a short period of time, for no more than 2 to 3 weeks. Unfortunately, a lot of people use muscle relaxants alone or in conjunction with other illegal substances for non-medical purposes, such as to induce or heighten euphoria and dissociation. Carisoprodol, marketed under the name Soma, is one of the most frequently diverted and abused medications, according to the U.S. Substance Enforcement Administration. It is classified as a Schedule IV drug. Additionally, the Centers for Disease Control and Prevention advises against consuming alcohol, other drugs, or muscle relaxants like Soma or Flexeril together. Abuse of muscle relaxants poses considerable risks, including a higher chance of overdose, which can result in seizures, hallucinations, coma, and death. The different types of muscle relaxers. Abuse of muscle relaxants can have a variety of negative effects, such as withdrawal, behavioral problems, and seizures. Early detection and understanding of these indicators of addiction are crucial because continued usage might exacerbate negative effects. Drugs that relax the muscles affect the central nervous system's ability to send spasmodic signals as well as the activity of muscle cells. These chemical reactions cause muscular tissue to relax and, in certain cases, cause paralysis. The 3 most commonly used muscle relaxers are Baclofen, Carisoprodol, and Cyclobenzaprine. They act differently and have different side effects, so it's important to consult with your doctor before taking any of them. Other muscle relaxers include tizanidine and orphenadrine. What are over-the-counter muscle relaxers? An OTC muscle relaxer does not require a prescription, but it may bear the same risks as a prescription muscle relaxer. There are no over-the-counter muscle relaxers apart from a handful of topical preparations. In the case of the absence of OTC muscle relaxers, there are other typically recommended first-line treatment OTC drugs such as NSAIDs or other painkillers. For now, topical muscle relaxants are among the best muscle relaxers over the counter. What are cannabis muscle relaxers? Tetrahydrocannabinol, THC, the compound in marijuana that gives users a euphoric high, may also have a soothing effect on their muscles, according to studies. Research on cannabis therapeutic advantages is limited because it is still illegal to grow, supply, and possess the drug in many locations. Therefore, more investigation is needed to discover whether cannabis or the substances it contains can lessen muscle spasticity or spasms. How long do muscle relaxers stay in your system? Muscle relaxants have calming effects or stop your nerves from transmitting pain signals to your brain. They also work as central nervous system depressants. The effects normally last between 4 and 6 hours, with a quick beginning of action. The amount of time it takes muscle relaxers to exit from your system depends on the specific drug you are taking. It's generally around 24-48 hours after your last dose. However, it can vary depending on the dosage, timing, and whether you have any underlying medical conditions. It's important to follow the directions your doctor gave you regarding any medication. Can you overdose on muscle relaxers? Muscle relaxant overdose symptoms can occur if the person takes a higher dose than prescribed. Other factors that can increase one's risk of a muscle relaxer overdose include increased tolerance, age, gender, polysubstance, and recreational use. Symptoms of an overdose vary depending on the muscle relaxer drug, but can generally include drowsiness, confusion, agitated behavior, nausea, and unconsciousness. If you believe you have overdosed on a muscle relaxer, it's important to seek medical attention right away. What are the side effects of muscle relaxers? In contrast to chronic pain, muscle relaxants are best indicated for acute pain. If the pain keeps you from obtaining enough rest, they might be an alternative. Muscle relaxants can aid in sleep when used at night because they make you drowsy. The most typical side effects are as follows: tiredness, drowsiness, or sedation effect, fatigue or weakness, dizziness, dry mouth, depression, decreased blood pressure. Warnings for prescription muscle relaxers. 2 muscle relaxants with a history of habit building are carisoprodol and diazepam. Take care to follow your doctor's instructions for taking your prescription medication. Muscle relaxants can also cause seizures and hallucinations or the sensation of things that are not real. These are known withdrawal symptoms. If you've been taking your muscle relaxer prescription for a while, avoid discontinuing it suddenly. Additionally, muscle relaxants decrease your central nervous system activity, making it harder to focus or retain consciousness. When using a muscle relaxant, stay away from activities requiring concentration or coordination, including operating heavy machinery or operating a vehicle. Muscle relaxers addiction treatment. There are a variety of treatments available for muscle relaxer addiction. These can include individual or group counseling, medications such as antidepressants and anxiety medications to help manage withdrawal symptoms, and alternative therapies like yoga and acupuncture. If you are struggling with muscle relaxer addiction, it's important to seek professional help in order to get the right treatment for you. That's it for today. If you like our video, please let us know. Have a great day.